81. A patient with lung cancer is experiencing severe pain and requires opioid medication. What is the nurse's priority assessment before administering the medication? A. Assess the patient's respiratory rate. B. Assess the patient's blood pressure. C. Assess the patient's pain level. D. Assess the patient's level of consciousness. Answer. A. Assess the patient's respiratory rate. Rationale. Opioid medications can depress the respiratory system. The nurse should assess the respiratory rate to ensure the patient can tolerate the medication without respiratory compromise. 82. A nurse is providing education to a patient undergoing chemotherapy about managing hair loss. Which of the following should be included in the teaching? A. Wear a wig or scarf if you feel self-conscious. B. Hair loss is permanent with chemotherapy. C. Hair loss can be prevented with medication. D. There are no ways to manage hair loss during chemotherapy. Answer. A. Wear a wig or scarf if you feel self-conscious. Rationale. Hair loss is a common side effect of chemotherapy, and patients can manage the emotional impact by wearing wigs, scarves, or hats if they choose. 83. A nurse is caring for a patient with a newly diagnosed brain tumor. What should the nurse assess first? A. Neurological status. B. Nutritional status. C. Pain level. D. Respiratory status. Answer. A. Neurological status. Rationale. The first priority in a patient with a brain tumor is to assess the neurological status to determine the extent of the tumor's effect on the brain and plan appropriate interventions. 84. A nurse is caring for a patient with pancreatic cancer. Which of the following findings is most concerning? A. Jaundice and dark urine. B. Abdominal pain and weight loss. C. Nausea and vomiting. D. Increased thirst and urination. Answer. A. Jaundice and dark urine. Rationale. Jaundice and dark urine can indicate a blockage in the bile duct, which is a common complication of pancreatic cancer and requires immediate assessment and intervention. 85. A nurse is caring for a patient with a history of colon cancer who is experiencing rectal bleeding. What is the nurse's priority action? A. Notify the healthcare provider immediately. B. Administer a stool softener. C. Provide a diet high in fiber. D. Encourage increased fluid intake. Answer. A. Notify the healthcare provider immediately. Rationale. Rectal bleeding in a patient with a history of colon cancer is concerning and requires prompt notification of the healthcare provider to assess the cause and initiate appropriate interventions. 86. A nurse is caring for a patient with leukemia who has thrombocytopenia. Which of the following should the nurse include in the patient's care plan? A. Monitor for signs of bleeding. B. Provide a high-fiber diet. C. Administer anticoagulants as prescribed. D. Encourage frequent ambulation. Answer. A. Monitor for signs of bleeding. Rationale. Thrombocytopenia increases the risk of bleeding, so it is crucial to monitor for signs of bleeding and intervene as needed. Other interventions may also be necessary, but bleeding precautions are the priority. 87. A nurse is caring for a patient receiving chemotherapy. Which of the following findings should be reported immediately? A. Anemia with a hemoglobin level of 10G/DL. B. Oral mucositis with painful mouth sores. C. A temperature of 100.4 degrees Fahrenheit 38 degrees Celsius. D. Fatigue and malaise. Answer. C. A temperature of 100.4 degrees Fahrenheit 38 degrees Celsius. Rationale. A temperature of 100.4 degrees Fahrenheit 38 degrees Celsius in a patient receiving chemotherapy could indicate an infection, which requires immediate intervention due to the risk of neutropenia and immune suppression. 88. A patient with prostate cancer is receiving hormone therapy. Which of the following should the nurse include in the teaching plan? A. You may experience weight gain due to fluid retention. B. Hormone therapy will prevent your cancer from spreading. C. You will be at increased risk for osteoporosis. D. The treatment may cause your hair to grow faster. Answer. C. You will be at increased risk for osteoporosis. Rationale. Hormone therapy for prostate cancer reduces testosterone levels, increasing the risk of osteoporosis. Weight gain and hair growth are not common side effects. 89. A nurse is caring for a patient with colon cancer who is postoperative day 2 following a colectomy. What is the priority nursing action? A. Assess bowel sounds and abdominal distension. B. Encourage the patient to ambulate. C. Administer prescribed pain medications. D. Monitor the patient's wound for signs of infection. Answer. A. Assess bowel sounds and abdominal distension. Rationale. After a colectomy, the nurse should assess bowel sounds and for abdominal distension to evaluate for potential complications such as ileus or bowel obstruction. Other actions are also important, but not the priority. 90. A nurse is caring for a patient undergoing chemotherapy and reports a sudden onset of chest pain. What is the nurse's priority action? A. Administer nitroglycerin as prescribed. B. Assess the patient's vital signs and oxygen saturation. C. Encourage the patient to take deep breaths. D. Call for a cardiology consult immediately. Answer. B. Assess the patient's vital signs and oxygen saturation. Rationale. The nurse should first assess vital signs and oxygen saturation to determine if the chest pain is related to a cardiovascular issue, as chemotherapy can increase the risk of cardiovascular events. 91. A nurse is caring for a patient receiving chemotherapy for lung cancer. The patient reports feeling very fatigued. Which of the following is the priority action? A. Administer a dose of vitamin B12 as prescribed. B. Encourage the patient to rest and conserve energy. C. Increase the patient's fluid intake. D. Have the patient perform light physical activity. Answer. B. Encourage the patient to rest and conserve energy. Rationale. Fatigue is a common side effect of chemotherapy. The nurse should encourage the patient to rest and conserve energy. Increasing fluids and vitamin B12 may help, but rest is the priority. 92. A patient with esophageal cancer is receiving radiation therapy. Which of the following interventions should the nurse include in the care plan to prevent mucositis? A. Encourage the patient to drink acidic beverages. B. Teach the patient to use alcohol-based mouthwash. C. Recommend the use of soft, bland foods. D. Advise the patient to avoid oral care during treatment. Answer. C. Recommend the use of soft, bland foods. Rationale. Mucositis is a common side effect of radiation therapy. Soft, bland foods are less irritating to the mucosa. Acidic foods and alcohol-based mouthwashes can worsen mucositis. 93. A nurse is caring for a patient who is receiving chemotherapy and has developed neutropenia. Which of the following is the priority nursing intervention? A. Monitor the patient's white blood cell count daily. B. Administer prescribed antibiotics for fever. C. Encourage the patient to maintain good oral hygiene. D. Place the patient on a high-calorie diet. Answer. B. Administer prescribed antibiotics for fever. Rationale. Neutropenic patients are at high risk for infection. A fever could indicate an infection, and administering antibiotics as prescribed is the priority. Other actions are also important, but infection control comes first. 94. A nurse is caring for a patient with colon cancer who is experiencing bowel obstruction. What is the priority action? A. Place the patient on a low-residue diet. B. Administer pain medications as prescribed. C. Insert a nasogastric tube for decompression. D. Encourage the patient to walk around the room. Answer. C. Insert a nasogastric tube for decompression. Rationale. A nasogastric tube is used to decompress the stomach and relieve symptoms of bowel obstruction. Pain management and dietary changes are also important but not as urgent. 95. A nurse is caring for a patient who is receiving chemotherapy for breast cancer. The patient reports feeling nauseated and has vomited several times. Which of the following is the priority intervention? A. Administer an antiemetic medication as prescribed. B. Encourage the patient to drink ginger tea. C. Offer small, frequent meals. D. Provide the patient with ice chips to suck on. Answer. A. Administer an antiemetic medication as prescribed. Rationale: the priority intervention for nausea and vomiting related to chemotherapy is to administer an antiemetic medication as prescribed to control symptoms. Other interventions can be used as adjuncts. 96. A nurse is caring for a patient with advanced cancer who is receiving palliative care. What is the primary goal of palliative care? A. To cure the cancer and prolong life. B. To provide symptom relief and improve quality of life. C. To treat the cancer with the latest therapies. D. To prepare the patient for surgery. Answer: B. To provide symptom relief and improve quality of life. Rationale: palliative care focuses on symptom management and improving the patient's quality of life, rather than curing the cancer or prolonging life. It addresses physical, emotional, and spiritual needs. 97. A nurse is providing care to a patient receiving chemotherapy who reports difficulty swallowing. What is the nurse's priority intervention? A. Assess for oral mucositis or sores. B. Offer soft, easy-to-swallow foods. C. Teach the patient swallowing exercises. D. Encourage the patient to drink liquids with meals. Answer: A. Assess for oral mucositis or sores. Rationale: difficulty swallowing may be caused by mucositis or other side effects of chemotherapy. The nurse should assess the oral cavity for sores or other signs of mucosal damage. 98. A patient with cancer is receiving immunotherapy. Which of the following is an expected side effect of this treatment? A. Constipation. B. Hair loss. C. Flu-like symptoms. D. Increased appetite. Answer: C. Flu-like symptoms. Rationale: immunotherapy can cause flu-like symptoms such as fever, chills, and fatigue due to the immune system's response to the therapy. Hair loss and constipation are more common with chemotherapy, not immunotherapy. 99. A nurse is caring for a patient receiving chemotherapy who is at risk for infection. Which of the following should the nurse include in the patient's plan of care? A. Encourage the patient to drink only bottled water. B. Keep the patient's environment free of fresh flowers. C. Encourage the patient to participate in group activities. D. Administer prophylactic antibiotics routinely. Answer: B. Keep the patient's environment free of fresh flowers. Rationale: fresh flowers can carry bacteria that increase the risk of infection in immunocompromised patients. The other interventions may be helpful, but are less critical for infection prevention. 100. A patient with breast cancer is experiencing severe pain and is prescribed opioids for pain management. Which of the following is the nurse's priority assessment? A. Assess the patient's pain level and effectiveness of the medication. B. Monitor the patient's respiratory rate and oxygen saturation. C. Assess the patient's nutritional intake. D. Assess the patient's emotional well-being. Answer: B. Monitor the patient's respiratory rate and oxygen saturation. Rationale: opioids can depress the respiratory system, so monitoring the patient's respiratory rate and oxygen saturation is the priority to ensure safety. Other assessments are also important, but not the first priority. 101. A nurse is caring for a patient with cervical cancer who is receiving radiation therapy. Which of the following is the priority nursing intervention? A. Teach the patient how to manage skin reactions from radiation. B. Encourage the patient to avoid sexual intercourse during treatment. C. Monitor for signs of urinary retention. D. Educate the patient about chemotherapy side effects. Answer: A. Teach the patient how to manage skin reactions from radiation. Rationale: radiation therapy can cause skin reactions such as redness or irritation, which need to be managed to prevent infection. Educating the patient about skin care is a priority. 102. A nurse is caring for a patient receiving chemotherapy for ovarian cancer. The patient complains of nausea and vomiting. What is the nurse's priority intervention? A. Administer prescribed antiemetics. B. Encourage the patient to eat small, frequent meals. C. Offer ginger tea to relieve nausea. D. Provide the patient with iced chips to reduce nausea. Answer: A. Administer prescribed antiemetics. Rationale: The priority intervention for chemotherapy-induced nausea and vomiting is to administer antiemetic medications as prescribed. Other options can be helpful adjuncts, but antiemetics are the primary treatment. 103. A nurse is assessing a patient with a history of lung cancer who is experiencing new-onset dyspnea. Which of the following should be the nurse's priority action? A. Administer supplemental oxygen as prescribed. B. Assess the patient's vital signs and oxygen saturation. C. Prepare the patient for a chest X-ray. D. Encourage the patient to cough and deep breathe. Answer. B. Assess the patient's vital signs and oxygen saturation. Rationale. Dyspnea can be a sign of a serious complication in lung cancer. The nurse should assess the patient's vital signs and oxygen saturation first to determine the severity of the issue before administering oxygen. 104. A nurse is caring for a patient receiving chemotherapy who has developed neutropenia. Which of the following should the nurse include in the care plan? A. Encourage frequent hand-washing by the patient. B. Place the patient on a high-fiber diet. C. Avoid use of prophylactic antibiotics. D. Limit visitors to those with active infections. Answer. A. Encourage frequent hand-washing by the patient. Rationale. Hand-washing is crucial to prevent infection in patients with neutropenia. Other measures may also be necessary, but frequent hand-washing is the most effective prevention. 105. A nurse is caring for a patient with leukemia who is receiving chemotherapy. The patient is at risk for bleeding. Which of the following should be included in the nursing care plan? A. Monitor the platelet count closely. B. Apply a warm compress to areas of ecchymosis. C. Encourage high-impact exercise. D. Administer aspirin for pain relief. Answer. A. Monitor the platelet count closely. Rationale. Patients with leukemia are at risk for thrombocytopenia, which can lead to bleeding. Monitoring platelet levels is essential to detect any signs of bleeding early. Other interventions are secondary to this. 106. A nurse is teaching a patient who has been diagnosed with breast cancer about chemotherapy. Which of the following should the nurse include in the teaching plan? A. You may experience hair loss, but it will grow back after treatment. B. Chemotherapy will cure your cancer completely. C. You should avoid drinking fluids during treatment. D. Expect your appetite to increase significantly. Answer. A. You may experience hair loss, but it will grow back after treatment. Rationale. Hair loss is a common side effect of chemotherapy, but it generally grows back after treatment ends. Chemotherapy does not always cure cancer, and increased appetite is not a common side effect. 107. A patient with advanced cancer is being transitioned to palliative care. Which of the following interventions is most appropriate at this stage? A. Start chemotherapy to reduce tumor size. B. Provide aggressive pain management. C. Offer the patient an experimental treatment option. D. Focus on curative treatments. Answer. B. Provide aggressive pain management. Rationale. The goal of palliative care is symptom management, including pain control, to improve the patient's quality of life. Curative treatments are not appropriate at this stage. 108. A nurse is caring for a patient undergoing chemotherapy for colon cancer. The patient reports a sore throat and difficulty swallowing. What is the nurse's priority action? A. Administer pain medication as prescribed. B. Assess the oral cavity for signs of mucositis. C. Encourage the patient to drink warm tea. D. Instruct the patient to avoid talking. Answer. B. Assess the oral cavity for signs of mucositis. Rationale. Mucositis is a common side effect of chemotherapy and can cause pain and difficulty swallowing. The nurse should assess the oral cavity for sores or other signs of mucosal damage. 109. A nurse is caring for a patient with cancer who is experiencing fatigue. Which of the following is the most important nursing intervention? A. Encourage the patient to rest frequently. B. Increase the patient's caloric intake. C. Administer a blood transfusion. D. Monitor the patient's hemoglobin levels. Answer. A. Encourage the patient to rest frequently. Rationale. Fatigue is a common side effect of cancer and its treatments. Resting is essential to conserve energy and alleviate fatigue. Monitoring hemoglobin and increasing caloric intake may also be important, but not the priority. 110. A nurse is caring for a patient who is receiving radiation therapy for lung cancer. The patient reports feeling fatigued and short of breath. What should the nurse assess first? A. Oxygen saturation level. B. Presence of a cough. C. Skin changes in the radiation field. D. Vital signs and respiratory rate. Answer. A. Oxygen saturation level. Rationale. The nurse should assess oxygen saturation first in a patient with shortness of breath to determine if hypoxia is present, which can lead to further complications. Other assessments follow, if necessary. 111. A nurse is caring for a patient with colorectal cancer who has a colostomy. Which of the following is most important to assess during the first 24 hours after surgery? A. The appearance of the stoma. B. The patient's ability to ambulate. C. The patient's level of pain. D. The patient's nutritional intake. Answer. A. The appearance of the stoma. Rationale. The nurse should assess the appearance of the stoma for signs of ischemia or necrosis in the first 24 hours after surgery. Pain management and nutrition are important but secondary at this time. 112. A nurse is caring for a patient with lung cancer who is receiving palliative care. Which of the following interventions is most appropriate for managing dyspnea? A. Administer prescribed opioids for pain relief. B. Encourage deep breathing exercises. C. Provide supplemental oxygen as ordered. D. Position the patient flat to reduce dyspnea. Answer. C. Provide supplemental oxygen as ordered. Rationale. Oxygen therapy is a common intervention to manage dyspnea in palliative care patients. Administering opioids may also help, but oxygen is the primary intervention for managing respiratory distress. 113. A patient with cancer is receiving chemotherapy and is at risk for nausea and vomiting. Which of the following is the best preventative measure? A. Encourage the patient to eat a large meal before chemotherapy. B. Administer antiemetic medications as prescribed before treatment. C. Have the patient drink ginger tea prior to chemotherapy. D. Encourage the patient to fast before treatment. Answer. B. Administer antiemetic medications as prescribed before treatment. Rationale. Administering antiemetic medications before chemotherapy is the most effective way to prevent nausea and vomiting. Other measures can be adjuncts, but are less effective as primary interventions. 114. A nurse is caring for a patient receiving chemotherapy who reports a metallic taste in the mouth. Which of the following should the nurse recommend? A. Avoid drinking water during meals. B. Use a saltwater rinse before meals. C. Increase the intake of acidic foods. D. Eat a high-protein diet. Answer. B. Use a saltwater rinse before meals. Rationale. A metallic taste is a common side effect of chemotherapy. A saltwater rinse can help neutralize the taste and improve comfort during meals. Other recommendations are less effective for this issue. 115. A nurse is caring for a patient who is undergoing chemotherapy and has developed alopecia. Which of the following interventions should the nurse include in the care plan? A. Encourage the patient to wear a wig or a scarf. B. Administer a scalp massage to stimulate hair growth. C. Suggest the patient avoid wearing hats. D. Provide information on hair replacement therapies. Answer. A. Encourage the patient to wear a wig or a scarf. Rationale. Hair loss, alopecia, is a common side effect of chemotherapy, and offering wigs or scarves can help the patient cope with the aesthetic changes. Scalp massages and hair replacement therapies are less practical interventions. 116. A nurse is providing care for a patient receiving chemotherapy for lung cancer. Which of the following side effects should the nurse anticipate? A. Increased white blood cell count. B. Sensitivity to light. C. Decreased platelet count. D. Increased appetite. Answer. C. Decreased platelet count. Rationale. Chemotherapy often causes myelosuppression, leading to a decreased platelet count, which increases the risk for bleeding. Increased appetite is not a typical chemotherapy side effect. 117. A nurse is caring for a patient with cancer who is receiving opioids for pain management. Which of the following interventions should be included in the care plan? A. Administer opioids on a fixed schedule to prevent pain. B. Encourage the patient to limit fluid intake. C. Monitor the patient for signs of addiction. D. Avoid offering pain medications if the patient requests them. Answer: A. Administer opioids on a fixed schedule to prevent pain. Rationale: administering opioids on a fixed schedule helps manage cancer pain effectively and prevents it from becoming severe. Monitoring for addiction is important but secondary. 118. A nurse is caring for a patient with breast cancer who has undergone a mastectomy. Which of the following interventions should the nurse include in the care plan for post-operative care? A. Elevate the affected arm to prevent lymphedema. B. Encourage the patient to perform arm exercises immediately. C. Avoid any exercise on the affected side for several weeks. D. Apply heat to the affected area to reduce swelling. Answer: A. Elevate the affected arm to prevent lymphedema. Rationale: elevating the affected arm helps prevent lymphedema after mastectomy. Arm exercises are important, but should be initiated after the initial recovery phase. Heat should not be applied to the affected area in the acute phase. 119. A nurse is caring for a patient receiving radiation therapy for prostate cancer. The nurse should monitor for which of the following side effects? A. Thrombocytopenia. B. Diarrhea. C. Hypertension. D. Alopecia. Answer: B. Diarrhea. Rationale: radiation therapy, particularly for prostate cancer, can cause gastrointestinal side effects, including diarrhea. Thrombocytopenia and alopecia are more common with chemotherapy. 120. A patient is receiving radiation therapy for brain cancer. Which of the following is the most important nursing intervention? A. Monitor the patient for signs of increased intracranial pressure. B. Encourage the patient to remain in bed during treatment. C. Administer antiemetics before treatment. D. Offer the patient a high-calorie diet. Answer: A. Monitor the patient for signs of increased intracranial pressure. Rationale: brain radiation can lead to complications such as increased intracranial pressure. Monitoring for signs of increased ICP is crucial. Other interventions support overall care, but are secondary to this.